Hello, my name is Dr. AB. I welcome you to lesson number 4 of this video course on this book, The Right Treatment for the Right Disease, a book that talks about all the various healthcare systems that we have classified broadly under alternative and orthodox medicine. The idea is to give you information that can help you make the right decisions when it comes to your healthcare so you can achieve positive results. Okay, so in this lesson number 4, we are talking about the placebo effect. Now, the placebo effect is so influential that when we are doing drug testing, we account for the placebo effect because some of the positive outcomes that have been observed in some alternative treatment may be due to the placebo effect. Okay, and so until whether the treatment is alternative or whatever you call it, until it is tested against the placebo effect, it is a placebo until proven otherwise. Okay, so what are placebos? Placebos are fake treatments. They are not actual treatments, but they are packaged to look like an actual treatment. So the person taking it does not know that he or she is taking a fake treatment. All right, and it produces some desirable therapeutic effects, not because it has medicinal properties, but because the person has the belief that it is an actual drug. So it works by expectation, positive expectation that it is a drug and is meant to solve some health problems, not because it has medicinal properties. And we have found out that even the packaging of the placebo pill or the placebo treatment affects health outcomes. It has been shown by research that a big placebo pill was found to be more effective than a small one. 2 placebo pills were found to be more effective than 1 placebo pill. A placebo that was a capsule was found to be more effective than a tablet. Then a beta placebo pill was found to be more effective than one that is not beta. It was found out that a placebo injection was more effective than a placebo pill or tablet. And a painful placebo injection was more effective than a placebo injection that was not painful. So it is all a matter of perception or beliefs, okay, or positive expectation in the treatment process. All right, so that is a placebo effect. Now, it sounds so much like a fallacy or some stories we tell people or bedtime stories we tell people, but there are 2 reasons why we believe the placebo is real. The first one is because it is accounted for in drug testing, and we call them placebo-controlled trials. So if the placebo is not influential, why do we account for them when we are testing for drugs? It is influential. A second reason why we don't discount the importance of placebos, or we don't downplay on the importance of placebos, is that the effects of placebo on the human body has been measured, okay, objectively by using imaging techniques called the functional imaging techniques. Just like we have structural imaging techniques like using the CT scan or using the X-ray to look at the structures of various organs of the body, okay. With the functional imaging techniques, you're able to tell metabolism going on in the body. You're able to tell absorption going on, blood flowing in the body, and all these techniques are being used to see changes that have happened in the person's body because the person has been given a placebo. For instance, it has been shown that the hormone called endorphin, or the neurotransmitter called endorphin, which is we call happy hormones, and it is implicated in placebo analgesia, that is placebo pain relief. Okay, it has been shown that when a placebo treatment is given as a painkiller, all right, these endorphins rise, levels of these endorphins rise to actually work on receptors that look like receptors for some pain medication like what we call the opioids, like morphine, okay, to produce some pain relief. So there have been some objective studies. It's not just subjective, people just reporting, okay, that I feel well. But I must admit that most of the outcomes seen in placebo studies have been subjective reports. Okay, that is when people talk about I feel something. I felt pain, but on the scale of 1 to 10, after taking the placebo pain medication, it has reduced from 8 to 6. So we don't usually see placebo working in trying to shrink a tumor or take away a fever, okay, and so on and so forth. Okay, let me also make this quick point that placebo use in medical practice is not acceptable because it is unethical to deceive somebody that I am giving you a treatment when it's a fake treatment or it is placebo. The only time we can do that is when we are conducting experiments or research, okay, and protocols have been designed to allow that to happen, but not when you are managing a patient. That is unethical. What we rather do in place of tricking patients to have a positive mindset is to create an environment, okay, for the patient to experience some positivity in the environment, to experience some positive expectations because of the confidence the patient has in the practitioner, in the environment, okay, or in the treatment itself, but not because the patient is being deceived that this is an actual treatment, it is actually placebo. All right. Some of the positive outcomes that have been observed in some alternative treatments may be due to the placebo effect. Okay, and so until whether the treatment is alternative or whatever you call it, until it is tested against the placebo effect, it is a placebo until proven otherwise. Okay,